Welcome to Principles and Practice of Health Assessment. This is the third part of our session 4, and we will look at assessment of the head, neck, and the regional lymphatics. And in this session, we will focus on examination of the neck for the midline structures such as the cricoid cartilage, thyroid gland, and trachea. And then we look at examination of the neck vessels. So for our overview, note that we have the structures on the neck, midpoint of the neck as the cricoid cartilage. Then we have our thyroid gland and the parathyroid gland showing in the diagram to my left. And then there's another diagram showing on the right, which further shows us how real the structures are in the neck. So starting with inspection, we inspect the neck and we note the areas and the location of the cricoid cartilage. So right inside the neck, whilst the patient is seated with the neck a little flexed, you inspect the neck and you observe the area of the cartilage, the trachea, and then the thyroid gland. You would direct tangential light. So tangential light is light that you flash towards the side, so it doesn't create a shadow and you can see. So you can see the patient's neck. So you direct the light, while the neck is flexed, you direct the light from the chin towards the neck and you observe the neck closely. Now you ask the patient to either swallow saliva or water and you observe the movement that will occur in the neck. So if I'm using my neck and I've directed the light from the light source should be bigger than what we have, but we can still use this. If I swallow saliva, you should see movement in my neck. So you ask patient either to drink water or swallow saliva as you observe the movements that occur in the neck. Then again, you stand in front of the patient and then you palpate the cricoid cartilage down. So you palpate the cartilage down. After you have stand in front and palpated, then you go behind the patient. So whilst you are behind the patient, you palpate, you ask the patient to flex the head backwards, ask the patient to swallow saliva or water which you give the patient, and while the patient swallows, you palpate and feel for the movement of the thyroid gland in the neck. During your examination, all structures should be smooth, firm, non-tender, and located in the midline. Common abnormalities that may be present is the patient will complain of pain, there could be nodules, the thyroid gland may be enlarged, and the trachea may be displaced. The next topic is examination of the neck vessels. Review your anatomy and be familiar with the neck vessels. To examine the neck, you ask the patient to lie down at the bed that is elevated to 30. And so the patient should lie in bed. Even for a patient who is sitting, you can still examine the neck, but preferably they should be lying down with the head end of the bed raised to 30 degrees. Then you inspect the neck for pulsation. If you are not able to see properly, you can still use tangential light, flash the light on the patient's neck, and then observe for pulsation of the carotid artery on the neck of each side, and then you palpate to feel for the pulsation, and you palpate one at a time. You do not press on both carotid arteries at the same time. One should be done. One carotid artery should be palpated at each time, and not both at the same time, because you will occlude the patient's arteries, and it can lead to emergencies in patients with heart problems. After you have pulsated or palpated the carotid artery, use your stethoscope and listen the sounds of the carotid artery. Use the bell of the stethoscope so that you can listen properly. And as you listen, note the amplitude, the contour of the pulsation, and note the rhythm or the time in between each beat as the patient breathes. Memory sounds may be heard if the carotid artery is narrowed, and you need to report these findings for further assessment. You need to listen and compare both sides of the neck. To examine the jugular vein, ask the patient to turn the head to the other side. So after you have listened to the murmurs in the carotid artery, the next thing is to examine the jugular vein. And to examine the jugular vein, tell the patient to turn the head to one side. And whilst the head is turned to one side, you shine your light, tangential light on the neck, and locate the external jugular vein. If this is not possible, then you need to apply pressure slightly above the clavicle. So if you can't see the jugular vein, you put a little pressure whilst the neck is turned, and as you press on, the veins will dilate, so you are able to see the jugular vein. And you do it on each side of the neck. Note the pulsation as well. And as you examine the jugular veins, compare the pulsation in both areas, and also compare it with that of the carotid pulsations. You may estimate jugular venous pressure by measuring the distance between the highest point of pulsation and the sternal notch, which is the end, with relation to the angle of the bed that you have used. This is a procedure that you will find in the video. So watch the video and see how the angle of the jugular venous pressure is measured. This is an advanced nursing procedure. For your assignment, perform physical examination of the neck on a client you identified during your clinical placement. Note the deviations in the structures and write your reports. These are your references.